Your mouth is like the only part of your body that traditional medicine just sort of decided wasn't actually part of your body.
Right, which is wild to think about.
It really is. I mean, think about it. If you have a severe infection in your arm, you go to a medical doctor.
Exactly, standard physician.
Yeah, but if you have a bacterial infection festering in your jaw, you are sent to a completely different industry.
Yeah, historically, dentistry was totally separated from standard medicine.
Right, relegated to barbers, basically, who just pulled teeth.
Literally barbers. It's crazy.
And for decades, the standard clinic felt like this isolation chamber designed purely for mechanical repairs. You just sit in a chair, smell that clove oil, listen to the drill, and endure it.
And that historical division created what was essentially a factory model of healthcare.
Yeah.
You present a broken part, like a cavity or a chipped tooth, and the provider fixes that immediate mechanical issue, and then you're just sent on your way.
Completely transactional.
Exactly. Completely transactional. It isolated the teeth from the physiological and really the psychological reality of the human being attached to them.
Well, today, we are looking at a blueprint that is tearing that historical wall down. Welcome to our deep dive.
Thrilled to be here.
Today, we are taking a close look at the operational materials and the clinical structure of CR Dental Group.
Yeah, they're an award-winning practice located in North Dallas.
Right, and our mission today is to analyze their approach to see how modern clinical design is shifting from simply, fixing teeth into comprehensive, anxiety-free health management.
We're basically examining the architecture of a modern patient experience.
Exactly.
By looking at the materials from this practice, and I should note their providers were actually recognized as D Magazine's 2025 Best Dentists, we can decode the strategic decisions behind their services.
Right, their scheduling, their environment, all of it.
Yeah, we are looking at this purely as an operational framework to understand how a modern medical business systematically attempts to remove friction and fear for you, the patient.
So let's start with the foundational logistics, because right off the bat, there is an immediate anomaly in their materials.
Oh, absolutely.
We know they're located physically inside a major healthcare hub, Medical City, Dallas, specifically at 7777 Forest Lane.
A very clinical, integrated environment.
Right. And we know they have built this highly specialized roster featuring Dr. Jordana Contrucci-Ruiz, Dr. James Reisman, Dr. Monica Goff, and Dr. Alana Reifer.
An impressive lineup.
But then you look at their actual operating hours, Monday through Thursday, 7:00 to 3:00 p.m.
Which is, that schedule immediately stands out against the broader retail and service landscape we currently live in.
It really does.
I mean, we are entirely conditioned by the market to expect extreme on-demand availability.
Okay, let's unpack this, because my first instinct when I see a business closing at 3:00 p.m. is honestly confusion.
Yeah, it feels early.
Right.
Yeah.
We live in an era of urgent care clinics flashing neon open until 9 p.m. signs and grocery delivery at midnight. So a 7 a.m. to 3 p.m. schedule, only 4 days a week, feels highly restrictive. It operates much more like an exclusive high-end boutique rather than a convenient modern healthcare facility.
It does seem that way at first glance.
Why turn off the lights just as kids are getting out of school?
Well, if we connect this to the bigger picture, those highly specific hours are actually a clinical strategy disguised as a scheduling quirk.
Really?
Yeah. It ties directly back to their advertised patient-centered approach.
Okay, how so?
To understand the logic, you have to look at the physiological and cognitive demands of dentistry.
Okay.
It's an industry requiring immense precision. You're working in millimeter tolerances inside a dark, wet, constantly moving environment.
Ugh, yeah, that sounds exhausting just thinking about it.
Right. That requires deep focus and sustained physical endurance.
So you were talking about the concept of decision fatigue.
Precisely. In the medical field, decision fatigue is a very measurable phenomenon. Every single micro decision a provider makes depletes their cognitive reserves.
Like a battery draining over the day.
Exactly. Statistically, a surgeon's or dentist's precision and diagnostic acuity can begin to degrade by 4:00 p.m. after a long shift.
Wow.
So by capping the clinical day at 3:00 p.m. and operating a 4-day work week, this practice is strategically engineering their environment to avoid that late afternoon burnout.
Because when a sharp drill is operating millimeters from your nerve endings, you definitely want a provider operating at absolute peak neurological energy.
Right, not someone grinding through the final hours of a 10-hour shift.
Yeah, viewing the schedule as a safety and performance protocol entirely changes the perspective. The limitation is actually a feature to protect the quality of care.
Exactly.
And for you, the patient, an opening time of 7:00 a.m. means you can theoretically go in, get preventative care, and be out the door before your standard workday even begins.
It is a highly optimized operational window. But applying that intense, hyper-focused window naturally forces a strategic question.
Which is?
How do they organize the actual clinical work happening within those constrained hours? They have to be ruthless about efficiency.
Right. And they do that by dividing their entire practice down into distinct pillars of care.
Yes, very clearly defined pillars.
Rather than just a blanket statement of, we do dentistry, they outline oral hygiene, which includes professional cleanings, gum disease prevention, and notably, dental education.
That last part is key.
Then they separate out restorative treatment. So that's your fillings, crowns, bridges, root canals, and implants.
The structural repairs.
Right. And finally, there is cosmetic dentistry, covering teeth whitening, veneers, bonding, and Invisalign.
So what stands out to you about breaking the treatments down into those specific siloed categories?
I honestly have to push back on the psychology of it.
Oh, why is that?
Does dividing dentistry into a massive a la carte menu actually help the patient? I mean, if I wake up with severe tooth pain, doesn't scrolling through categories of restorative versus cosmetic just create more cognitive overload?
I see what you mean.
I'm paying the dentist to be the expert. Shouldn't they just look at my mouth and dictate what I need?
That is a very natural assumption, assuming the old factory model of medicine.
Right.
But what's fascinating here is this categorized structure is a deliberate psychological tool designed for patient empowerment.
Empowerment? How?
It shifts the burden of intention. In the old model, you sit in the chair, point to your mouth, and passively say, "Fix me."
Yeah, that places all the agency onto the doctor.
Exactly. But by separating an implant, which restores the mechanical biological function of your bite, from a veneer, which purely enhances the aesthetic symmetry of your smile, the clinic is forcing you to clarify your own internal goals before the consultation even begins.
Oh, I see. It changes the opening dialogue of the appointment?
Exactly.
It moves the conversation from what is broken to what are we actually trying to achieve today?
It creates an active partnership, and you can see that partnership explicitly confirmed in their oral hygiene pillar.
Right, with the education aspect.
Yes, they list dental education and home care instructions as a tangible, standalone service right alongside professional teeth cleaning.
Which is huge.
They are openly stating that transferring knowledge to you, the patient, is just as critical as scraping away the plaque.
So you are paying for the biological maintenance, but you are also paying to learn the mechanics of how to prevent the decay in the first place.
Right.
And that focus on holistic maintenance leads us directly into a part of their blueprint that completely shattered my expectations of what a dental clinic actually
Not
does.
just specialized treatments.
Yes, they had a category literally labeled specialized treatment.
This is where the historical wall between dentistry and general medicine that we discussed earlier completely collapses.
It really does.
Yeah.
We look at this specialized menu, and they offer diagnosis and treatment for TMJ disorders.
Which is highly complex.
They offer same-day dental emergency care for sudden infections or traumatic injuries to the teeth. But here's where it gets really interesting.
Oh, yeah, the sleep apnea part.
They offer custom oral appliances for the treatment of obstructive sleep apnea. I mean, if you are a patient accustomed to thinking of sleep apnea as a respiratory condition or something you only treat by going to a sleep specialist for a loud CPAP machine, finding it on a dentist's service menu is completely disorienting.
It really is. And this raises an important question. Why is a provider traditionally tasked with fixing cavities treating a potentially fatal breathing disorder?
Right. It seems so out of place.
To understand the mechanism, we have to look at the anatomy. Obstructive sleep apnea occurs when the muscles of the jaw and throat relax during deep sleep.
Okay.
This relaxation allows the tongue and the soft tissues of the palate to collapse backward, physically blocking the airway.
So you literally stop breathing.
Yes. You stop breathing, your brain panics, and it jolts your central nervous system awake just to gasp for air.
So the jaw is essentially the physical scaffolding that holds the airway open.
Exactly. Because a highly trained dentist is the ultimate specialist in the structural alignment and mechanics of the jaw, they are uniquely equipped to intervene.
That makes so much sense when you put it like that.
They can engineer custom oral appliances that subtly hold the lower jaw forward during sleep.
And that mechanical shift prevents the soft tissue from collapsing.
Right. Keeping the airway open without the need for forced air from a loud CPAP machine.
And that anatomical expertise explains why they are treating TMJ disorders as well.
Absolutely.
The temporomandibular joint is the complex hinge connecting your jaw to your skull. It is acting as a heavy-duty shock absorber every time you chew or speak.
Yes, and when the small cartilage disc inside that joint slips out of alignment, or the surrounding muscles spasm from grinding, it restricts blood flow and inflames the surrounding nerves.
Which sounds incredibly painful.
It is. It causes severe chronic pain, clicking, and restricted movement that radiates up into the head and down into the neck.
So by treating sleep apnea and rehabilitating the TMJ, the clinic is stepping far outside the boundary of just the teeth.
Way outside.
Which brings us back to their physical location. They are inside Medical City, Dallas.
Right, the integrated environment.
They aren't isolated in some standalone strip mall. They are physically embedded into a massive hospital and healthcare ecosystem.
They are strategically positioning themselves as an integrated node in your broader healthcare network.
Yeah.
They are treating systemic, whole-body oxygenation and neurological pain issues, simply utilizing the mouth as the biological gateway to address them.
But, implementing complex airway mechanics and reconstructing inflamed jaw joints creates a massive new problem for the clinic.
The anxiety factor.
Yes. These are highly intimate, physically invasive procedures. How does a clinic perform complex structural work on a patient whose nervous system is in a state of full fight-or-flight panic?
It's a huge hurdle. Dental anxiety is recognized as one of the most pervasive medical phobias globally.
I believe it.
Letting another human being place their hands in sharp metal instruments inside your airway triggers a very primal evolutionary vulnerability.
But this clinic's blueprint addresses that psychological barrier proactively through their comfort and sedation offerings.
Yeah, they don't hide it.
No, they don't just offer the vague promise of sedation. They outline a highly specific, tiered approach.
A very clear menu of options.
Right. They list nitrous oxide, which they classify for reducing basic anxiety. Then they list oral sedation, which is a medication taken prior to the appointment for deeper relaxation.
Yeah.
And finally, they offer IV sedation, delivered intravenously for a profound state of physiological detachment.
The clinical transparency here is key. They are mapping out the precise pharmacological tools they use to bypass the brain's panic response.
So what does this all mean for the patient experience? Think about it like a home security alarm system.
Oh, I like this analogy.
If you just have a little bit of nervous energy, you opt for nitrous oxide. It acts like a white noise machine. The alarm is technically still on, but you are distracted and kind of floating above the anxiety.
Right, just taking the edge off.
Then oral sedation is like throwing a heavy lead blanket over the alarm bells.
Yeah,
The system is still armed, but the bells are so muffled you barely register them, and you often won't even remember the noise afterward.
very true.
But 4FE sedation. Forcivation is walking into the basement and cutting the hardwire to the alarm system entirely.
That perfectly illustrates the pharmacological mechanisms at play.
Right.
Nitrous oxide works by replacing nitrogen in the blood, mildly depressing the central nervous system while you remain fully conscious.
Okay.
Oral sedatives interact with the neurotransmitters in your brain to induce heavy drowsiness and amnesia, but 4V sedation, that directly crosses the blood-brain barrier for immediate, profound neurological control.
Wow.
The provider can literally adjust the depth of your consciousness minute by minute.
And the strategic brilliance of this blueprint isn't just that they have these tools, is that they aggressively market them alongside the other major barrier to healthcare money.
Oh, yes, the financial fear.
In their FAQ section, they explicitly highlight flexible payment plans and financing options, specifically noting they help patients choose plans that fit their personal budgets.
If you analyze the psychology of patient avoidance, the hesitation to book a medical appointment almost entirely boils down to two factors.
Fear and finance.
Exactly, the fear of physical pain and the fear of financial ruin. Fear and finance.
So, by systematically outlining the sedation tiers to neutralize the pain, and clearly offering flexible financing to neutralize the bill, they are dismantling the patient's defensive walls before the patient ever picks up the phone.
It's brilliant.
They're managing the psychological hurdles of healthcare before they even look at the physical ones.
It proves their stated goal of building a rewarding relationship with the patient.
Right.
You cannot build a relationship with someone who is too terrified of the drill or the invoice to even walk into the building.
So true. So to synthesize this operational blueprint for you listening, CR Dental Group provides a clear window into how modern, high-level healthcare is being designed.
A very clear window.
By optimizing their clinical hours from 7 a.m. to 3 p.m., they mitigate decision fatigue and protect provider precision.
Right.
By categorizing treatments and elevating education to a standalone service, they shift you, the patient, from a passive subject to an active partner. By utilizing the jaw to treat whole body conditions like sleep apnea and TMJ, they integrate themselves into holistic medicine. And by transparently mapping out pharmacological sedation and financial flexibility, they completely neutralize the fear that keeps people sick.
It is a profound paradigm shift away from the historical factory model.
It really is.
And analyzing the source material leaves us with a compelling final thought.
Well, what's that?
The clinic explicitly states their goal is to provide a long-term strategy for optimal oral health.
Right.
But when you step back and consider that they are custom-fitting mechanical devices to cure your sleep apnea, physically rehabilitating the complex joints connecting your jaw to your skull, and actively managing your central nervous system across the blood-brain barrier via IV sedation, where exactly does the boundary of the dentist's chair actually end?
Wow.
At what point do they simply become your primary care physician for the head and neck?
That is the perfect question to end on, because the historical line dividing the mouth from the rest of the body isn't just blurring anymore. It is completely disappearing.
Absolutely.
Thank you for joining us on this deep dive today. We hope you take this framework and look for those hidden structural blueprints in your own world.
Keep looking.
Whether you are analyzing how your next medical appointment is designed or just observing the subtle ways businesses try to manage your friction and fear, keep questioning the mechanics behind the services you use.
Always.
And the next time you think of that classic terrifying waiting room smelling of clove oil, just remember that the industry is rapidly evolving to ensure that room becomes a relic of the past.